And today is the 1600. Sorry.
Sir, you have been made the host now.
Yeah,
Are you
please.
Okay, yeah, you are the host now. Okay, thank you, sir.
Thank you, sir. Thank you. Today is the 1697th day of uninterrupted daily webinar of IFPH. Before beginning the session, let's have a silent prayer. Hello, doctors, students of homeopathy, and friends of homeopathy. Today is the 1697th day of uninterrupted daily webinar of IFPH. And today's our guest is Dr. Jessica Monteiro, Associate Professor, Department of Medicine, KLE Homeopathic Medical College, Belagavi. She has around 14 years of experience in homeopathy consultation and about 12 years of teaching experience in homeopathic medical colleges. She had her bachelor's and doctorate post-graduation from AM Sheikh Homeopathic Medical College, Belagavi. Currently pursuing fellowship in medical education from Manipal Academy of Higher Education, Manipal. Has completed her MSc in psychology. Completed an intensive course in research methodology and biostatics from KLE Academy of Higher Education and Research, Belagavi. Has completed certificate course in food and nutrition. He is presently the member of Committee for Collaboration and Community of the Research Cell of KLE Academy of Higher Education and Research, Belagavi. Has been an external and internal examiner in the university exams to different homeopathic medical colleges under Rajiv Gandhi University of Health Sciences, Bangalore, and KLE Academy of Higher Education, Belagavi. Has been a resource person for a guest lecture on the topic mind and body health and menstrual hygiene at various schools in Belagavi. And today, our topic of discussion is usefulness of integrating common counseling techniques in homeopathic practice. Let us welcome the speaker, Dr. Jessica Monteiro. Doctor, please, let's start the session.
Yeah, thank you so much, sir, for having invited me, and thank you for moderating the session. I welcome all the guests and the participants today for the workshop. The topic, shall I start, sir?
Yeah, sure.
Yeah, okay. So the topic today that I'm going to talk is usefulness of integrating common counseling techniques in homeopathic practice. Is my slide... So before I start my
slides are not visible, just the screen is only.
Are you... Is it now?
No, it didn't start it. Yeah, now it's okay. We can make it.
Now it's okay.
Yeah, you can enlarge the slides. Make it full screen. Yeah, that's good.
That's fine?
Yeah, fine. Let's start.
Okay, the objectives for my session will be, the participants today will be able to understand what are the common counseling techniques and what is their potential and how we can use them and enhance our homeopathic consultation. We'll be able to, at the end of the session, analyze different case scenarios and discuss how we can integrate these counseling sessions and their usefulness. And finally, by the end of the session, probably we'll be able to reflect how can we integrate these counseling sessions or these therapies into our present practice. Like we know, homeopathy is something where mental symptoms, understanding the patient, giving them some kind of counseling is ingrained into our case taking and also into the process of finding the simillimum. So compared to any other system, we use counseling to a larger extent. And all of us do that probably knowingly or unknowingly. So I thought when one becomes aware of those techniques, probably in a proper way, or maybe we are able to understand it in a more theoretical way, and we are able to apply it in a standardized format, probably that would help us more, rather than what we are doing is just without any awareness, or maybe without any proper training in counseling. So counseling does play a very important role when we are dealing with our patients. Of course, the remedy, the simillimum, is the highest uh, objective of our treatment, but counseling is an aid which we should not be missing in today's practice. So to start with it, I would just like to define what is counseling. So counseling is the application of mental health, psychological, just a minute. Yeah, psychological human development principles through cognitive, affective, behavioral, or systemic intervention strategies that are used for the wellness, personal growth, and career of an individual. So basically, what we are trying to do in counseling is we are trying to use this at the cognitive level to change their behaviors, and along with our simillimum, and also to form strategies how we can enhance the wellness of our patient, how we can help them in their personal growth, how can we help them in their career. So this is something which counseling definitely aids in. And me, after finishing my MSc in counseling, I have personally seen the difference before me knowing those standard practices or therapies. And now, when I am using them in a more systematic way, that has really helped me in my personal practice. Therefore, I thought maybe we can share that. Now, why do we need counseling along with our routine case taking? It helps the patient develop an insight about what is happening to them. When we talk to them, we are able to bring an insight rather than just giving them a simillimum. When we counsel the patients, we are bringing a kind of insight into them. We are making them self-aware about what is their condition. Sometimes the patient needs self-acceptance, and it's not so easy. So self-acceptance is one of the majority or goals that we see is required in counseling. Problem solving. Most of our patients come with so many problems, maybe personal problems, career problems, relationship problems, marital problems. So problem solving techniques along with our remedies would be a great combination. Sometimes there is need for the way they think. So probably by our way of counseling, if we are able to bring that change in their cognitive behavior, that would be a great add-on to what we are currently doing during our case taking or during a homeopathic treatment. And finally, along with the simillimum, when we empower the patient towards change, that becomes a positive use of counseling, and that should be why we should be using counseling apart from our routine practice, what we do in right now, what we do it in homeopathy. So I'll just quickly go through what is the process of counseling. Of course, I know all of us do that, but probably when we do it in a more standardized way, I think it will be more helpful to all of us. So there are 3 stages of counseling. So the first stage, like all of us are taught in case taking, most of us, the first thing objective of case taking is like we need to have a rapport with the patient. We need to build a relationship, a therapeutic relationship with patient. And the similar thing is with counseling. So when we are having a kind of relationship, a therapeutic relationship, either the patient is able to open up, we are able to take the case more properly. Maybe the patient then has a trust, develops a trust. We only know that we should be building. When we teach our students, we only tell them that we have to develop a rapport with the patient. But when we use these right techniques of counseling, probably that rapport buildings becomes more easy. The patient easily generates that trust in the therapist or the homeopath. So how do we do that? How do we build the relationship? That is by empathetic understanding. You have to build an environment where the patient feels that you are caring, you are empathetic, you are understanding, and that's one core principle of building a therapeutic relationship with the patient. You have to have this counseling principle, that is unconditional positive regard. Of course, the patient comes with so much of already weight from the outside world. When the patient do not feel valued from an homeopath for their problems, when they feel that we as homeopaths are judging them, probably they may not open up, the case may not be fully fledged opened. So unconditional positive regard, one of the core component of counseling, will definitely help us all to even start the case taking part. Forget about at the end how to counsel them. So this process of counseling, unlike what the other therapists do, it's like, once they are diagnosed, and then it's just an add-on to whatever treatment they are giving. But here, if we start these counseling techniques in the initial phase of our case taking, probably the patient would be opened up. You can see the case more, maybe the lens gets wider. One again, when we want to build a therapeutic relationship during this process, when we are merging case taking and counseling together, respect the client or respect your patient. So that focus becomes more important. And also, when you are doing this counseling, of course, Dr. Hanneman also has asked us, whenever the patient is not opening or he is not, he's going in the deviating from his process, confrontation. So when you are counseling also, you need to tell the patients that maybe they are right or maybe they are wrong in a proper way. So sometimes confrontation really works. So this is the first process where you need to develop these core components when you are talking to the patient. And I believe when we are case taking and we are simultaneously doing this counseling process, that's a best combination we can use as homeopaths. And no other system or no other system of doctors can use counseling as greater to a greater larger extent like we can do. What is the stage 2? Once we have finished counseling, taking their case, next is we can use this stage or process of counseling is assessment and diagnosis. Now, this assessment and diagnosis is not diagnosis of the remedy or diagnosis of the condition. This assessment and diagnosis is what the patient is needing. Understanding what is wrong with the patient. That helps. Counseling definitely is at a greater or a larger extent helping us to understand the mental state of the patient. So this assessment, when you are doing this process, you are able to achieve a very great therapeutic relationship at the start. Your assessment and diagnosis at what level of mental state the patient is can facilitate us to come towards the minimum, maybe take into account a lot of the patient's state, and also you can also this helps you in knowing what technique later on you can use, what goal of counseling you can use. So the third stage comes, what are the type of counseling you want to use? It could be motivational, it could be educational, or it could be evaluation. Now, what does that mean? Motivation. Some of your patients would just need some kind of motivation. For example, a calcaria patient. A calcaria patient is always inside a cocoon. She is very homely, doesn't want to, she is very anxious, wants to do, but doesn't like to do, does not want to get out of the safe zone. Maybe when you can motivate, of course, you're going to give calcaria patient, you out of your case taking have understood, or you have diagnosed, or you have known that this is a calcaria patient. But now that kind of insecurity what the calcaria patient has, maybe the calcaria patient does not want, is not able to go forward in their career because they like to be in that zone. So you can motivate the patient along with giving calcaria. When you do this motivation, probably because you know calcaria is missing with the motivation. So when you are motivating the calcaria patient, probably that becomes a greater help to the patient rather than only giving calcaria. Okay, next is education. Now, some patients are not aware. I said one of the goal of our counseling is to bring about awareness in the patient. There are some patients who are not aware. Maybe you can take an example of staph aureus, or you can take an example of sulfur or a platinum. So these patients, for example, sulfur or platinum, these people are into a delusion state. They are platinum lady would think that she is the greatest and everybody is below her. So that kind, and the platinum lady would not be aware that by her talk, by her actions, she is trying to demean people around her. So just bringing in that kind of education around her, that this is how you are behaving, probably slight change in this way could help you to a larger extent. Of course, there is going to be a lot of change when you give platinia as a constitutional remedy, but there is no harm in adding on a counseling technique and educating the patient about their state. And here maybe a platinia patient would not need a lot of motivation like a calcarea patient would need, but here bringing about a self-awareness, educating the patient about their situation would be great help to a sulfur patient or a platinum patient. So this is how this counseling can be used. Evaluating. Now, evaluating, let us take an example of natriuretic. The natriuretic patient is something who only suppresses, like we know, natriuretic suppresses emotion, suppresses. So they are not aware that they are suppressing. So when you ask the patient to evaluate what is happening to them, you can use this counseling to evaluate the patient. There, the natriuretic may not need motivation, they need evaluation. So when you know that you need to motivate the patient, or you need to educate the patient to bring about a self-awareness, or you need to evaluate the patient's mental condition and tell them that this is what is happening with you, and maybe this slight deviation or change into positivity may make things more easier for them. So that is how we can use these three stages of counseling, or this is how the process of counseling can be, this framework could be used. Build up a therapeutic relationship that could be simultaneously done with your case taking. Understand and assess what is the need of your patient, whether they need a motivation, whether they need education, or whether they need an evaluation. So when a patient is not at all motivated, you cannot just keep on evaluating them and educating them. Or some patients like Naxwamika, they don't need any motivation. They are already leaders. They only need to evaluate. So that is how, and this combination I feel is a great combination when we can use counseling with our homeopathic remedies of understanding and individualizing the patient. When you individualize the patient, you get the drug, and then when you use these techniques, that is absolutely fantastic, and I find it really, really very helpful in my practice. So this is the process of counseling. Now I will quickly go through certain techniques or certain techniques of counseling, on what are those different types of counseling. I'll not go into the detail, but just by knowing them, probably we can use it patient to patient. So there's one of those counseling techniques called as person-centered therapy, where the core principle of this person-centered therapy is to accept the patient as they are and to make them feel accepted. So how do we do that? We need an active listening. So when a patient requires a person-centered therapy, for example, a patient of natriuretic is completely suppressed. So they need somebody to hear them out. A calcarea patient is completely timid, doesn't talk, is very silent. So what happens is, compared to a pulsatilla patient, or a patient who is very talkative, so these people may not require so much of active listening because they are already telling, they know how to tell. But those patients who are introvert, maybe they require this person-centered therapy. They need to feel that positive regard. They need to feel that they are accepted. They need to feel that somebody is empathizing with them, and only then they will open up. So in this person-centered therapy, active listening plays a very important role. Active listening was where you pay very close attention. When you are by your verbal cues, the patient knows that you are listening to them, and also you have to take up their verbal cues because they will not open up very easily. So for such type of when you individualize your patients according to these types of constitution, maybe you can use person-centered therapy, where there is a lot of empathy, there is a lot of unconditional positive regard, and the patient feels that you are genuinely listening to them. Now this is one point of it. Now secondly, when these type of people, they require, for example, a calcarea patient would want their family members also to be to listening to them. They want that kind of security. A wife or calcarea, a wife who is a calcarea patient always finds a kind of security in a husband who listens to her, because she is very homely. She wants that kind of environment where she is feeling safe, where she is feeling respected. So that is how CPR, when she is not respected, she completely goes into an aversion mode. She is the most she is the one who is so much family oriented, but when she has that aversion towards the family because of the disrespected given to her or whatever, she goes into an aversion state. So you need to tell your not only this person-centered therapy helps in understanding the patient. When we use another therapy called as family therapy, where you are also making your other family members aware of what is the need of the patient, because you know now, for example, you know a calcarea patient, what does they need? They need a lot of security, and by counseling their family members, you are providing that deficiency into their calcarea patient, and that helps the patient to open up. So reflecting on the feelings, active listening, clarification of why you do that, what is happening to you. All these are the techniques which can be used in person-centered therapy, where the person is the focus. So this is one technique. So next is the common one which is used, that is cognitive behavioral therapy, that is called as CBT. There are so many subtypes to it, but what does this cognitive behavioral therapy in counseling is used? It is used to change the way the patient thinks. It is used to bring about a change in their behavior, change in their cognition, change in their awareness, change in their feelings and their cognition. So it works on the cognitive level. Now let me give you an example of a Nux vomica patient. A Nux vomica patient is a born leader, right? They are somebody who do not follow rules very easily because they take the ownership of everything. So now when this Nux vomica patient would definitely face some career issues, would face problems in the workplace. And when they come to you, and you would understand that most of the ailments are due to overworking, due to ambitiousness, and all these things are there in a Nux vomica patient. So you need to know that when you are into a workplace, there are certain rules that need to be abided. But Nux vomica patient usually doesn't do that. It really doesn't sometimes even take orders. So bringing up that cognitive restructuring. So when you did this, and that is why that was the response of your boss. When you try to tell this to them in this cognitive behavior therapy, probably you are helping more along with your Nux vomica, when you are able to restructure them by bringing up that awareness into them. So that will help them to a greater extent. Behavior activation, that helps this clients or your patients to engage them into a meaningful understanding about what they are, or why these things are happening, or bringing a meaning to their situation. We use this in cognitive behavior therapy, also could be used in lot of cases of anxiety. Let me again take an example of argentum nitricum, where there is fear of examination, or you take argentum nitricum where there is fear of height, agoraphobia, and all these things. So what happens in cognitive behavior therapy? You're bringing, the patient knows that they have a fear of height. They know that but they do not know how do we overcome that. So in cognitive behavior therapy, or there is another therapy called as exposure therapy, we can use 2 or 3 therapies together in combination. So you are making them aware by this is the problem you are having this, and they also know. So restructuring their cognitivity and telling them that when you go to a height, nothing is going to happen. You need to make them aware that this is not the kind of anxiety or fear is to a larger extent. That is an exaggerated fear, and bringing them and use exposure therapy, where you take the patient to that particular situation and slowly you go on increasing the intensity. For example, there could be a patient who would be scared of darkness, or scared of pins, like Silesia. You take, for example, Silesia. Silesia has fear of pins. So initially during your therapy, you can keep some pins around, just expose to them to that fear, maybe in different intensities. And this exposure therapy, when you use along with your medicines, maybe once they are exposed to that particular fear, step by step, that kind of cognition or that kind of fear slowly gets diminished. That we call it as exposure therapy, which can be combined with cognitive behavior therapy. So you bring an awareness in them, that there you do a restructuring about their cognition, and then in case if there is an anxiety or a known fear in patients like argentum nitricum, Silesia, you can definitely use this exposure therapy, which I would be telling you a little later on. There's another way you can do that is, yes, exposure therapy, it's there here. So you can use it in cognitive behavior therapy, but the environment would be safe. You bring them to a height where they are it's not harming the patient, and then you slowly increase the kind of exposure intensity. Then you ask the patient to record how many times they feel scared or anxious about the day, and when they confront their anxiety, how they feel, and once they are exposed, how was the intensity of fear. So a kind of day booking, or kind of tracking their thoughts, writing down their thoughts. So this could be a great process in getting down the anxiety along with your medicine. So this combination really works to a greater extent. There is another psychodynamic therapy. Now, this psychodynamic therapy is basically going back to your suppressed emotions. When your patients have deep wounds, deep early childhood trauma, anxieties, like in case of natremure, or in cases of Staphylococcus aureus, where they would have experienced some kind of insult, or it could be ignatia, where there is a death of maybe a disappointment, death, and it has been growing for a long time, and it has been fueling into them, and they are not able to expose. So this is rooted in that Freudian theory, where it goes into a psychodynamic therapy, goes into an unconscious level, and tries to nullify that conflict which has been growing, and slowly healing that conflict or that traumatic situation. Now, in the psychodynamic therapy, we do that interpretation of their behavior, dream analysis. There is a transference. For example, when a Naxwamika patient, or a Ignatia patient, or a Staphylococcus aureus patient who is highly irritable because of some kind of old insult, that kind of irritability could be during the session transferred to the patient. They are irritated because of some experience, and they also get irritated towards the homeopath when they are talking. So that is a very important concept in counseling, where there is transference. So they bring on their feelings into the physician, or the vice versa thing also happens. And in psychodynamic therapy, we do a lot of dream analysis, because we want to bring back that conflict situation from the subconscious mind into the conscious mind. And analyzing of dream in the psychodynamic therapy becomes of a greater extent, because most of the time I see my students, ma'am, there was no dreams here, I couldn't find any dreams. Of course, you're not going to find dreams in all the situations. You cannot only hang on to dreams, because whenever they have some unresolved conflicts, whenever they are into the conflict is at a subconscious level, only then it will start showing it in their dreams. Otherwise, if it is at a superficial level, most of them would not show it. So if they are at a superficial level, you cannot keep on wasting your time digging into their dreams, because they will not. And that is why I tell my students, some of the patients would come out and explicitly explain their dreams, while some may not, because those things are depends on what level the conflict is, at the subconscious level, at the conscious level. That will help. So exploring their dreams in psychodynamic therapy, interpreting their behavior unconsciously, the way they probably it could be the natremure who patients who really do not like to express. They are highly introvert because they have built in that kind of wall. They do not want to go to express. Or it could be a pulsatilla patient, because they are just expressing things, because and they feel better by weeping. I would like to give you an example of my patient who was a pulsatilla patient. She is a lady who is to be very tearful or always weeping disposition. The typical weeping disposition what we see in our books was so much present in her. And I believe her husband was either a natremure or he would be a lacasis. I do not know, because he used to hate people crying. And the moment this lady cries, he used to get more irritated. And this lady feels that I am crying and my husband is not even this, because he used to get irritated when somebody cries. And this is the kind of, and this was increasing her weeping disposition. She was feeling she is not being heard. Of course, her husband was giving her lot of concentration. He was taking care of her, but because he was not taking into the consideration her weeping disposition. And pulsatilla, like they feel great after weeping. And this person, her husband, hates people crying. And this was a deadly combination, because this was not getting resolved for many days. And I did a family therapy for both of them. I tried to understand the wife and try to also understand the husband's constitution here, because only understanding the wife's constitution was not helping me more. Then I understood him, and then I counseled him, saying that maybe she just wants your attention towards her when she is crying, because she feels better only when she cries, and that is what she has told you a number of times. And then when he became aware that this is what is the need of her wife, and that's why he was plainly saying, oh, she could have told me this long before. So it was so simple for him, but he was not aware and she was not understanding. And when this kind of counseling was done, things got much easier, because he became aware. Now when he was getting irritated on her because she was crying, now when I counseled him and told her this weeping disposition is irritating her problem because you're not giving attention to her weeping, things got much easier. And of course my remedy helped, but also my counseling did to a larger extent help both the couple in coming to a consensus of what their problem was. So this brings about these kind of understanding, awareness among not only the patient, but also the family member. So this is dialectical behavior therapy. This is usually used in psychiatric cases like schizophrenia, or any other case where we use this mindfulness technique. We teach the patient to be very mindful, not be very harsh on themselves, observe, focus on one thing. So that happens, like you can use this in cases of anxiety. People who are very anxious, you can ask them to be mindful of their behaviors or their problems. It helps them to regulate their emotions when they are. This also helps them to gain a lot of acceptance about their situation, because until they accept themselves, why am I feeling, why am I so coward? For example, a lycopodium patient, he is very good at speaking, but he requires that push. But so many times they feel that why am I having this stage fear? That question mark remains with them, because not everybody is going to have that push from their family. So when they understand, when they accept them, so probably that helps them to a larger extent, and that these therapies help them to regulate their emotions, because most of our patients are dealing with a lot of mental stress which cannot be told to their family ones or family members, cannot be expressed to their workplace colleagues. So this emotion regulation, because every time they need to accept themselves and regulate their emotions, identify their emotions, reduce the vulnerability they have, and increase the positiveness in them. So this can be a combination of motivation, positivation, education, evaluation. All these things could be added to these. So this was dialectical behavior therapy. There is another thing what we can do in our patients. Most of us do this, but we can do it in more structured way. It's called as motivational interviewing. It is an it is another type of person-centered approach where we use the strength of the patient to motivate and commit for the change. For example, you take a calcarea patient. They are so homely, they are so much into the family, and you can ask them to explore why they are. You can ask open-ended questions. You can encourage them, explore them when they are stuck. Maybe a calcarea patient, if she is stuck into the in career, if she comes with some career related problems and the ailment is related to her workplace or career or whatever, so you can encourage them to focus on both, because these calcarea patients I have seen when they face a lot of guilt for not giving enough time to their patients when they are focusing on their career, because like calcarea is a very homely and family is the priority for her, whereas a Naxwamika patient would not face a lot of guilt because they are ambitious patients. So in such cases, you can encourage them, ask them to explore their situations, and you can guide them with some kind of affirmations. You can ask the patient to reflect on their situation, because sometimes when their children do not, I had a couple of patients when their children do not do their homework and they are not getting some good marks, maybe due to whatever XYZ reasons, these patients take it as a deficient on their part. They feel that most of the mothers come and tell me, maybe I am giving a lot of preference to my work, and that is why my children are not, especially females, children are getting less grades, and those grades are really not that great. But this is the guilt these patients built. I could give you an example again of calcarea. So you ask them to reflect that that's enough time that they are giving. This guilt is unnecessary what they are building it. And when you ask them to reflect, you ask them to see, so that becomes more easier. And when they summarize their whole experience, probably it gives them a lot of cognitive change. Their behavior gets changed, and this along, again, I'm going to keep on repeating this sentence all through the workshop, all through the seminar, that this is going to be really great for us when we combine our case taking, our simillimum, and counseling techniques. And when we teach this to our students, it is a deadly combination, mind us. So this is how we can help our patient come out of their emotional restrict they are going, especially when we talk about lifestyle diseases, psychosomatic diseases, where most majority of our diagnoses are getting classified into psychosomatic disorders. So this are going to be really of a greater help, and that is how we can use these counseling techniques into our homeopathic practice. So I have just rushed across these common techniques that we can use in a structured format, and I know all of us are doing this. We all, out of our experience, have been using one or the other method of counseling, but I just feel that maybe doing it in a structured way could add on to our experience and help our patients to a little better extent than what we are doing right now. I was talking a lot about family therapy. So family therapy is most of our issues. You take a Staph aureus patient. I have a couple of patients who have issues in their families, issues with their in-laws. They feel that they are not enough given respect in their families, or it could be like, the vice versa. The children coming out with behavioral changes. The wife feeling so much suppressed because she doesn't has any help. These are common things most of us see. And when we do this kind of therapy, because we are giving the medicine only to the patient, but when we talk with the family, when we have a systematic approach and we know what is the problem within the family, like I gave you an example of the pulsatilla patient who had the sweeping thing, and she was feeling not understood, and the husband did not like her crying. And that was when we sat with the family together, that systematic understanding about what was going wrong did a magic to my patient. Communicating, most of the families do not communicate and do not talk. So only giving a medicine, maybe calcarea or nux vomica, to the patient when they are not communicating well in their families, would act like, to a larger extent of what Dr. Hanneman has told us, and maintaining costs. So these communication problems within the family, problems, a marital discord which is not sorted out, and the patient every time goes back to in that situation, maybe would act as a maintaining cause. So here, the problem would be at the level of communication within the family, a problem with understanding within the couples. So this together, when this maintaining cause or all these issues, when they are acting as a maintaining cause, we all as homeopaths know that it is not going to help our patient to a larger extent when the maintaining cause is going to remain. Whatever is your remedy, you're giving a specific, you're giving a constitutional, or whatever you are giving, till this maintaining cause is not going to get removed, this is going to remain with the patient. Your patient is not going to improve to a larger extent. So focusing on the way they are communicating within the family, there could be loss of communication within the children and their parents. So you have so many skin cases, so many headaches, migraines, and so many that we treat with the patient, but the problem lies in some of these issues. So communication with the family to a larger extent helps. So family therapy is something we can use in most of our cases. This reframing their relation within the family helps them. And I see that the family is so thankful because they are not aware about what is happening and why it is happening. And the minute you make them aware, they are more than happy to extend that the help to the patient requires, along with our remedy. So family therapy is going to be of great help to all of us who want to use it along with our standard practice that we have in homeopathic care. So there is a group therapy. Now, group therapy could be used in career, in your workplace, where people come out with lot of career concerns, or people who have similar issues. So what happens in group therapy is, when people who face the same problem, when they are counseled together, they have that awareness that only I am not suffering. This problem is universal. So maybe it could be so many times we see in our workplace where one employee feels that I am the one who is deprived, but when he meets another employee from a different company or different college, and they are also suffering with the same problem, and then say he also has same problem, and I am unnecessarily making a mole out of, or a mountain out of a mole. So this group therapy, sometimes when you have, I don't know how we can, most of the time group therapy does not work in homeopathy, because you cannot club 2-3 patients. But if you can do that, you can have because this group therapy cannot be simultaneously used with your your case taking. You have to specially grade your or group your patients suffering from the same ailments like or having the same kind of constitution. You can group to them together, and maybe you can have this group therapy where you guide them together. And when they are having this kind of feeling where not only me, I'm not the only victim, but there are so many people also suffering from the same problem, it becomes very easy for them to accept the problem. So these things could be used together. You can add it as an add-on to your practice and see how group therapy could be used. But when patients are able to share their problems or know that they are not the only one suffering from these kind of problems, especially this happens with mothers. When mothers are facing or parents are facing problems with their with adolescents, and you have some other parents also facing the same problem. So in those cases, when there is such group therapy, they are able to connect to their problem. Or also some people, you have lot of patients who are suffering because there are some kind of sick people in their house, chronic illnesses in their families. They would have a CA patient from a long time, and such patients group therapy help because they all are suffering from the same problem and they are having the same environment where they can connect to each other. So group therapy is a type of therapy. How? Because it cannot be simultaneously used with your case taking. Maybe you can give them some examples, but this is up to us how we can use it. But this is another therapy which could be used. Sometimes I give free, once or twice I have tried doing where 2 or 3 similar mothers suffering from the same problem or suffering from the same conditions are brought together, and just it's not a part of your treatment, but you just tell them that you are having the session and you can join in, and that makes them all the more, it helps them to a larger extent. So again, what are the homeopathic approaches, or how can we use this counseling? I told you, I gave you enough of examples of how argentum nitricum, how you can use this exposure therapy in agoraphobia, in fear of dogs, like, if a patient requires carcinosin, fear of dogs, fear of death. You can aconite, silesia. These are all cases where you can use the exposure therapy, where you expose the patient and you make them aware that this is how, and you can slowly decrease the fear along with your homeopathic medicines. I gave you an example of sepia. Sepia is a lady who eventually develops an aversion towards their family. But when you have a family therapy with a patient who requires sepia, because why is she having aversion, and this is told to their parents, to their children, to their family members, and you can arrange for a family therapy, this would be to a larger extent again helping a sepia patient along with your this delusions, sulfur platinum. I said again, bringing them back to a person-centered therapy would be great in delusion, where you are making them aware, you are educating them about what is wrong with them. Ailments from emotion, like we have in staphylococcus area, making them aware of why this is happening to a larger extent helps. Ailments from irritability, impatience, and nux vomica, you have to make them aware that this is what it is and this is how you are reacting. So to a larger extent, this is how we, and when we are talking about sadness, a patient is depressed, he is sad. Now he is sad with irritability, you have a different approach. He is sad with apathy, he is so helpless, phosphoric acid. So again, 2 different therapies can be used with them. You can use motivational in one, and you can just use an educational in another. So sadness with disgust, again, sepia, making them aware of family therapy. So these are all the things. Sadness with cheerfulness, pulsatilla, how we can use family therapy here. So these are the different ways where we can use these counseling techniques and elevate your practice, help the patient a little more, and maybe these in the fast moving world where we need to catch up with whatever is happening around us, we can teach our students to also use a little more of counseling techniques to help the patients more than what we are helping. I know all of us are doing our best. Maybe when we have these add-ons, that could be of a larger extent. And I personally have a lot of benefit by using this counseling techniques in my practice. So this is all I had for today's session. I hope you enjoyed it.
Thank you, Doctor. We had a very fast roundup on these cases and all. Means the cognitive behavioral therapy, psychodynamic therapy, family therapy, group therapy. You covered all aspects of the these therapies.
I hope it
And I
was not
think,
fast. I hope it was not fast.
No. We got all. We got all. It's great. Overall, we got an impression. What about counseling and homeopathy case taking? We do have some questions and queries in our mind. You explained. And this is a time to interact with the speaker. You can raise your hand that I can invite you. So by doing this, we can motivate the person, patient, to an extent.
Yes.
And understanding the, while taking the case as a homeopath, while taking the case, we can understand the situation and we can do some counseling techniques also. We can incorporate person-centered therapy also with this, isn't it, Doctor?
Yes, because I'm telling you, counseling is not easy. Not all of us can counsel because patients are there are certain core principles that you need to have empathy. You need to give respect to the patient. So your core principles have to be ingrained. So when you just talk to them is not counseling. So most of us have this when we are taking case, we just talk to them. We are not aware of those principles. So most of the time you see patients do not open up. It's only when they get acquainted to you. But if you want to do that process a little faster, probably when you are aware of how you are talking and when you use these core principles of counseling, you are able to start that first stage of counseling, that is build a good therapeutic relationship. What Dr. Hanneman has been telling us in our case taking, you have to have a rapport with the patient. So how do we that? We are told that we have to have a rapport with the patient and we learn it out of our experience. But when we ingrain these core principles of counseling, maybe your process of building a rapport becomes more easy. The patient can trust you, and maybe you can find the totality, individualize the patient, find the minimum in a more easier way. So that's how I think that will help us.
Okay, and the other thing I need to ask you is that if a natural person or a phosphorus person, if both type of person is having the same set of complaint, these two won't be reacting and two won't be expressing to us in the consultation like similar ways. Okay, it will be very much different. So by giving the medicine itself, we can somewhat we can correct the person, and without counseling itself, we can make the person to normality. But the circumstances from where the person came, or the circumstances which made the person to be in that position, won't get corrected. So we need to rehabilitate. We need to correct these things. Can assure a psychologist can do that.
Yes.
Than a homeopath, I think.
Yeah, of course. If it is to a larger extent, then you have to, that is why we integrate, you have to send them to a psychologist because we are not trained to do that. But not all your patients you can always refer to a psychologist. So this is a first-hand, whatever you can do, you can help the patient. And when it is when it is intensified, you can definitely take a help of a psychologist, because all of us know that every patient you cannot send to a psychologist. But all of our patients have mental issues or mental symptoms are so much. So you are definitely, because if a patient is going to our allopath with whatever problems, he is not only allopath. I just do not want to use anybody, but apart from homeopath, they do not consider their mental state. If when they have a problem with their husband or have a problem with their headache is relieved, that's okay. But we are much more interested that headache is relieved. I'm okay with that, but you should feel better with that. You should be able to come out of that situation. So for us, every session or every patient requires counseling. So we cannot always send the patient for a reference. It's always good that we know the basics. And when it is an intense case, definitely we are not trained for that. You can definitely send them for a counseling therapy. So that is why I said, no, in group therapy, you cannot do it always. You can, when there is group therapy, you can send them there.
Doctor, what do you think? If a person is coming for our consultation and we are getting a lot of mental symptoms also, and do we need a counseling in the beginning or in afterwards? Because if we are going to counsel the person, I am getting that notion that if a person is being get counseled in the beginning, these mental symptoms will be suppressed. That's the thing we think as a homeopath. So first of all, we need to collect the mental symptoms, physical generals, and rare peculiars, and we need to find out the most minimum medicine for the person. After the treatment itself, we need to do something. If we need to rehabilitate, or we need to fix something extra and send to a psychologist. Isn't it like that, or I need a correction?
I would like to answer it in a little different way with whatever knowledge and experience I have. It's like a situation whether the egg came first or the chicken came first. So it's like that situation because let me just again bring back to your understanding the case I told you of pulsatilla. The pulsatilla patient was a pure patient. I gave her a constitutional patient and she was a pulsatilla patient. But her problem was she was getting aggravated always because she was not being heard. She felt that like, I am weeping, but nobody is, because they want consolation. They feel better by consolation. And that was not being happening to her. So what happens is when you do not do that simultaneously with counseling, even if you give them a similar, a constitutional remedy, that maintaining cause is not removed. So when these mental symptoms, ailments are acting as a maintaining cause, you give them whatever remedy, that's not going to give 100% result until and unless you do that. And when you do this counseling, only then you will come to know that this is her problem. So it is a simultaneous thing. So it depends on case to case, but at a larger extent, I feel when you do counseling simultaneously, that is going to help you to a larger extent, because our patients who have these ailments from whatever mental issues, if that is not getting sorted out and it is acting as a maintaining cause, how are you going to wait for it to get completely sorted out? So that's how I feel.
Okay, that's great. So the catharsis or the way the person is making his symptoms talked out will also help the person a lot. So sitting quietly without interfering, without being a prejudiced person, we not need to interfere in between, and we need to make the person to speak out. This is the thing we need to do it first, isn't it?
Yes, correct.
In counseling itself.
Yes. So in counseling, what are you trying to do? One of the goal of counseling is making the patient aware. We are not doing anything. And in a homeopath, it's like a double-edged sword. You're giving the medicines, you're counseling, you're doing everything. So that's fantastic. And you are just making them aware. You are a facilitator here. So you act as a facilitator. And that I think we are fortunate enough that we have homeopathy with us. And when we counsel, that's a feather to the cap.
Thank you, Doctor. It's very informative and it's very motivating to us all. And we got a lot of information about, because case taking is not counseling. And as homeopaths, we need to know more about counseling and to get more proficient in this thing, in this technique also. Thanks a lot. Come again. On behalf of IFPH, I thank you all for listening this session. Thank you, Doctor.
Thank you.
And
Thank you, sir.
it's now time to pass over the session to Malayalam.
I would just like to say hello and namaste to Ram Prasad Shah, sir. Namaste, sir. I hope you enjoyed the session.
Thank you, Dr. Jessica Monteirio. Very nice presentation. Thank you for your insightful presentation. Common counseling technique and psychodynamic technique and etc. technique, yani case technique, just like homeopathic case technique. The very nice presentation. Thank you. Very, very thanks.
Thank you, sir. Thank you. Thank you so much.
Thank you, Dr. Ram Pravesh,
Thank
and
you.
thanks
Thank
all.
you. Thank you.
Over to Malayalam.
I think Dr. Danish has something to say.
Yes.
Please, Dr. Danish.
Thank you, Dr. Jessica and Dr. Binduraj for excellent session. And tomorrow we will have a session from Dr. Chanda Chandran, and Dr. will be talking about in male infertility for tomorrow English session. Thank you all.
Thank you. Thank you so much.
Dr. Shaila.
Thank